So today, we're going to take a guided tour of our body's hidden highways, that super complex network of blood vessels in our arms and legs. We're going to explore what happens when these vital pathways run into trouble, from really strange compressions and blockages to even glitches that happen before we're even born. But first, let's start with a little puzzle. What could a young, super healthy athlete and a longtime jackhammer operator possibly have in common? I mean, it turns out they can both end up with surprisingly similar vascular problems in their limbs. It seems totally random, right? Well, stick around because the answer reveals some pretty fascinating things about how our bodies work and how they can be affected by both our anatomy and our actions. All right, first up, we've got vessels under pressure. Here, we're looking at conditions caused by something on the outside squeezing in. The easiest way to think about it? Imagine stepping on a garden hose. The flow gets cut off. That is pretty much what's happening to these blood vessels, just with body parts doing the squeezing. Okay, so a classic example here is May-Thurner syndrome. This is what happens when the right iliac artery crosses over and just presses down on the left iliac vein. It's a simple little anatomical quirk, but it's a huge cause of deep vein thrombosis, that's a blood clot, or DVT, specifically in the left leg. So, whenever a doctor sees a mysteriously swollen left leg, this syndrome is often a prime suspect. Now, if we head down to the area right behind the knee, we find something called popliteal entrapment. This usually affects young men, and it happens when the popliteal artery gets squeezed by the gastrocnemius muscle. That's your main calf muscle. It's basically a developmental issue where the muscle and the artery are just a little too close for comfort. This causes big problems, especially during exercise when that muscle is contracting and really clamping down. So the crucial difference here is just keeping track of what's doing the squeezing and what's being squeezed. With May-Thurner, you've got an artery squishing a vein, but with popliteal entrapment, it's a muscle squishing an artery. See? Two different mechanisms, but the same basic problem. Something on the outside is restricting blood flow. And get this, the pressure doesn't always come from a normal body part. Sometimes, cysts can actually grow around a vessel, slowly choking it off from the outside. This is called cystic adventitial disease. It's another unusual cause of a blocked popliteal artery, and again, you typically see it in young men. So up to now, we've seen problems caused by pressure from the outside pushing in. Now we're shifting our focus. In Section 2, Bumps and Blockages, we're going to look at damage that starts inside the vessel wall itself. And here we meet the popliteal aneurysm. This is the most common aneurysm you'll find in the peripheral arteries, and it's located right behind the knee. You can think of it like a weak spot that's bulging out in a tire. But here's the thing you really have to know. The biggest danger isn't that it's going to burst. No, the real threat is that clots form in that sluggish, bulging area, and then they travel downstream, blocking off blood flow and threatening the entire leg. And wow, this is not some rare one-off thing. A staggering 50 to 70% of popliteal aneurysms are bilateral. You know what that means? If a doctor finds one in one leg, there's a very high chance there's another one hiding out in the other leg too. And the connections just keep going. Between 30 and 50% of people with a popliteal aneurysm also have an aortic aneurysm, which is often called a AAA. And this link is absolutely critical because it highlights that weak spots in blood vessels can be a body-wide systemic issue, not just a single local problem. Okay, remember our jackhammer operator from the beginning? This is their story. The condition is called Hypothenar Hammer syndrome, and it's this perfect, predictable chain of events. First, you get repetitive blunt trauma to the palm of the hand. Second, that impact damages the ulnar artery by basically crushing it against a small bone. Third, an aneurysm or a clot forms right at the site of chronic injury. And fourth, tiny pieces of that clot break off and travel to the fingers, blocking blood flow. It's just a textbook case of an occupational vascular injury. So we've covered issues from outside pressure and inside damage. Now, in Section 3, we're looking at what happens when the blueprints go wrong from the very start. This is all about congenital vascular malformations, problems people are born with because their vascular plumbing just didn't get assembled correctly in the first place. Now, this is a really, really important distinction. Vascular malformations are not the same as hemangiomas. Malformations are there at birth, and they grow as the child grows. They don't just pop up and disappear. And the most fundamental way we classify them is by how fast the blood is moving through them. It's either low flow or high flow. And that difference in flow speed, it's the key to telling two major syndromes apart. On one hand, you have Klippel-Trenaunay Syndrome, or KTS. That's a low-flow condition. It typically involves a mix of things like port wine stains, overgrown tissues, and venous malformations. On the other hand, you have Parkes-Weber syndrome. This one is high flow because it has a true arteriovenous malformation, which is a direct, high-pressure shortcut between an artery and a vein. And this is exactly why getting it right matters so much. There's this fantastic kind of blunt quote from the source material that says, Klippel-Trenaunay Weber is something people say when they don't know what they are talking about. I mean, it's a bit harsh, but it perfectly captures why you can't just lump these two together. Distinguishing between a low flow and high flow problem is critical because you treat them in completely different ways. Okay, moving on to our fourth section, we hit this fascinating, almost paradoxical idea, the healing that hurts. This is all about situations where the body's own attempt to repair itself actually becomes the problem. The condition is called intimal hyperplasia. And listen to this quote. It's often called the bane of endovascular intervention. I mean, that really sets the stage for what a major headache this is for doctors who are trying to fix blood vessels. So, how does this happen? Well, it starts when a doctor performs a procedure, like putting in a stent to open up a blocked vessel. But then, over the next 3 to 12 months, the body's healing response just goes into overdrive. The inner lining of the vessel, the intima, it starts to thicken, almost like an internal scar that's just growing out of control. And eventually, this healing tissue ends up narrowing or blocking the vessel all over again. It's like you tried to unclog a pipe, only to have the pipe itself grow inward and clog itself up again. Before we jump into our last section, let's take a quick detour for a really interesting piece of medical trivia. It's about something called venous thromboembolism, or VTE. That's the blanket term for dangerous blood clots like DVTs in the legs and pulmonary embolisms in the lungs. Now, surprisingly, patients with paraplegia actually have a higher risk of developing VTE than patients with tetraplegia. It's totally counterintuitive, right? The risk is higher in patients with what's called a complete spinal cord injury, so total loss of motor function, which, makes a little more sense. All right, for our final section, we're looking at a diagnostic tool that is just brilliantly simple, yet it tells an incredibly powerful story. This is the ankle-arm ratio, and it's a single number that gives us this huge, big picture view of a person's circulatory health. The ankle brachial index, or ABI, is pretty much exactly what it sounds like. Doctors measure the systolic blood pressure, that's the top number in your reading, at the ankle, and then they compare it to the systolic pressure in the arm. This super simple ratio is a remarkably effective screening tool for peripheral arterial disease. The numbers really do tell the whole story. A normal ratio is around 1, which means the pressure is about the same in both places. But if that ABI drops below 0.9, that's a red flag for peripheral arterial disease. And as it gets lower, the symptoms get worse. An ABI between 0.5 and 0.3 often means claudication. That's that cramping pain you get in the legs with exercise. And an ABI below 0.3, that can signal rest pain, a sign of really severe disease. Now, there is one important catch. Patients with diabetes can have falsely high readings because their arteries can get so stiff and calcified that they can't be compressed properly for the test. And that brings us to our final thought. Our vascular system is absolutely brilliant at healing itself from damage, but what happens when that very healing process goes too far and becomes the disease itself? That's the central paradox of a condition like intimal hyperplasia, and it's just a powerful reminder of the delicate balance that our bodies have to maintain every single day.